Let's start off with Japan. We're now seeing the virus spread beyond just Tokyo now, but they're still able to bring down the mortality rate. So what are they doing that's being effective on this side?
Yeah, what we're seeing in terms of the virus cases so far, we did hit another milestone, Heidi. Virus cases passing 1,000 for the first time. Tokyo seeing 250 on Wednesday. Osaka as well, close to beating the capital as the nation's biggest hotspot. That's according to NHK, where the Western Prefecture reported at least 220 new infections. So Osaka seeing a huge spike now after nearly a month of seeing 0 cases. And yet, as you mentioned, the country still avoided a surge in overall fatalities during its deadliest month of the pandemic. Back in May, when the country was under that state of emergency, the death rate actually dropped by 3.5%. So far, it seems like those that have been affected are people of a younger population. It hasn't spread to the older communities just yet. And Japan has also been avoiding mass testing in the early phases of the outbreak. The concern was whether the impact of the virus may be worse than expected. This latest data, though, shows perhaps the government's testing methods have not led to a large number of uncounted deaths linked to COVID-19.
And Yvonne, let's turn to India, because there's been a steep drop in infections in Mumbai slums, even as the country's overall cases grow at the fastest pace globally. So what's going on?
Yeah, this is very interesting, Sherry. It seems like herd immunity may be developing in these slums. This is according to a survey where they looked at 7,000 people or so in 3 suburbs in Mumbai, and they found 6 in 10 slum dwellers have developed antibodies. And this looks to be one of the highest population immunity levels known worldwide. You compare that to similar studies that were done in New York City that found 21%, Stockholm, which reported only 14% of people that developed antibodies. And we know in Sweden, this herd immunity has been a very controversial strategy where the country has seen more deaths than neighboring ones that implemented lockdowns. And just to give you some context, these slums in Mumbai, they can pack a population as big as San Francisco into an area the size of New York's Central Park. Up to 80 people sometimes can share a bathroom. Social distancing is basically impossible, and it's a breeding ground for the virus to spread. So why have infections come down? Keep in mind also in these Mumbai slums, the population is mostly younger. They're less exposed to perhaps more severe cases, but still either it's herd immunity or the government has done a good job in containing the virus in these vulnerable areas.